Hi, everyone. I'd like to do a shout out to our sponsor, Baco Diagnostics. Early detection is the single most important factor in improving patient outcomes. The Baco Diagnostics team recognizes how impactful a podiatric physician can be and remains committed to supporting you in your role as the first line of defense in diagnosing conditions of the lower extremity. Thanks to the unwavering support of their clients, Baco Diagnostics has been able to give back to the podiatric community for 16 years by providing podiatric educational resources and advocating for the position. Baco Diagnostics, helping podiatric physicians keep America on its feet. If you have not yet had the opportunity to utilize Baco Diagnostics services, get started today by sending an email to corporaterelations@bacodiagnostics.com. The first 50 podiatry offices who request a starter kit will receive a Dean's Chat mug. Hello, everyone. Welcome back to Dean's Chat, where we discuss all things podiatric medicine. My name is Dr. Jeffrey Jensen. I'm the Dean at the Arizona College of Podiatric Medicine and co-host for the Dean's Chat podcast. I'm with my co-host, Dr. Joanna Richey. Hi, Joe.
Hey, Jeff. How you doing?
I am doing fabulous. How was your long holiday weekend?
Oh, it was absolutely lovely. It was kind of a lower key one for us. My in-laws came over and just kind of enjoyed being together. We played a fun new game as a family called Do You Even Know Me? Of course, my kids had to add, Do You Even Know Me, Bro? But nonetheless, everybody enjoyed it. It was super fun. And it was really cute to see my in-laws answer questions about each other and about my husband and about my kids. And it was just fun. It was a really fun game. So how about you?
We were in Wisconsin. I was kind of prepping for this interview because I knew Dr. Levick was in the Chicagoland area. So we were back in the Midwest and got to see a lot of family and had too much food and just a wonderful time.
Yeah, good times.
All right. Well, hey, let's get rolling today. I'd like to introduce, coming back for the second time, Dr. Lisa Levick, this time by herself. Last time was with Boards Blast. Hopefully you all had a chance to watch the Board Blast interview. It was outstanding. And Dr. Levick, we are very, as you know, informal on Dean's Chat. If it's okay with you, let's go Lisa and Joe and Jeff.
Sounds good. Thank you so much for having me. It's so great to be back. Thank you.
You're
also,
welcome.
my kids, by the way, my kids were definitely doing the whole 6-7 thing. I don't even understand the 6-7 thing, but it was the whole time.
Yep. Yep. It got banned in my kids' school class or their classroom. So then they came up with 41. They're going to come up with something. So now it's not just 6-7, but it's also 41 in the house. So, I don't even know. We just random numbers that they get really excited about. And so.
Love it.
Well, thank you so much, Lisa, for coming on. I'm really excited about the chance to kind of dive into a more personal interview this time. So we'll kind of go through a little bit of a brief bio, but then we'll go through, because you have an amazing CV. So we'll go through some of the other specifics as we go through the interview today. But Dr. Levick is currently the CEO and owner of Levick Foot and Ankle Institute in Northbrook, Illinois. You did your undergraduate degree at Michigan State University, got your bachelor's of science in physiology, went on to complete your doctorate of podiatric medical degree at the Scholl College in Illinois. You went to the West Coast then for your 3-year surgical residency training program with the Greater Los Angeles Veterans Affairs, UCLA, and Kaiser Woodland Hills area. But I think, if I remember correctly, you have a whole nother life as a performing artist. So I would love to first kind of go into that part of your life. And then can you tell us how you found out about podiatry?
Yeah. Oh my God. I can't believe you're bringing that up.
I have to. I was an art major, so I love people that came in with a different perspective and background.
So art and music actually are in the same part of the brain as math and science. Mm-hmm. So it kind of goes hand in hand, which is fun. But I have been in musical theater since I've been about 4 years old. I have been in numerous shows. And there was this time in my life where I was kind of making that decision of, I'm good enough to be a doctor, right? I'm smart enough to be a doctor, but there's that whole other portion of that desire to be something huge and do what your dreams and that whole thing. And so, my parents said to me, they're like, do you want to go to New York and try it? Do you want to bus tables? And as soon as they said that, my brain just shut off. I was like, absolutely not. I've worked at the Olive Garden. I'm not doing this. But I was in musical theater for a very long time at Michigan State. I was a musical theater minor. And I think that's definitely helped me on my path as well. I think there's something to be said about public speaking and using those types of skills to teach an AO course or give a lecture at ASC and sound somewhat interesting as opposed to someone monotonous just speaking on, their current research. But I've been singing forever. My first show was Wizard of Oz, and my last show I think was Footloose. I mean, it's been a while. There are patients that come to see me that ask me to sing with them, which I think is hysterical.
I love that.
I'm singing Foot Doc on Instagram still. I used to teach lessons, and it's been a part of me forever. And my husband's just waiting for me to do my next show. So we'll see if I ever have time for that.
Do you still stay involved at all?
It's hard.
Yeah.
Now that I own my own practice, it's very difficult. But I go to all the shows in the city. I still support all my friends who are in New York who are making it, which is great. But it's a different lifestyle now. So
yeah, and certainly too. I know you've said that you have children. It's trying to manage all of the things. Like at some point, something has to give. So I can absolutely appreciate that. But every once in a while, people are still engaged in some kind of direction or another. So I figured if you were, we'd give you a little shout out for it. So how did you find out about podiatry?
So there's two stories. There's like the story of the professional way, and I'll tell you the professional way, which is I really wanted to be a surgeon and I didn't know what I wanted to do. So I knew I have really small hands. I have like size 6 hands. I don't know if you can see those, but I knew there was no way I could do ortho. These large joints, couldn't hold a drill for the life of me. So I knew it was between hand and foot, right? So that's where the professional answer comes from. But really and truly, the most unprofessional answer comes from the fact that I actually had a crush on my podiatrist son. And so going back to around high school, when I started shadowing doctors, I just wanted to be in that office at all times. But no, foot and ankle has always been part of me. I've been in orthotics since I was 3 years old. There was a large orthopedic group back in Michigan where I grew up, and they really wanted to do hip surgery on me. And there was a podiatrist who we were friends with who said, she doesn't need hip surgery, she needs orthotics. And he basically saved my life. He basically saved like years and years of pain. And I've been wearing orthotics since I've been 3 years old. I've had no issues since. So there is some, nice story to it, not just a crush on a podiatrist's son.
That's fantastic. Jeff, your thoughts?
A couple thoughts, questions. Where in Michigan by chance?
So I am from originally Farmington Hills.
Oh, for sure. Okay.
Yep, which is like about 20 minutes west of Ann Arbor. So go green, went to Michigan State, loved it. It's a great school for physiology and any medicine major. And I think that physiology degree gave me such a great background, especially for medical school. I actually thought a lot of my classes at Michigan State were easier than at Scholl, believe it or not. And I think that it gave me a large, way of perceiving medicine because it gave me all these opportunities to shadow different doctors, and podiatry just fell into place for me. So.
Oh, that's fabulous. When you were commenting on your friends who you grew up with that stayed in New York and they're making it, it's never greener on the other side of the fence. They're probably in New York saying, oh, my friend Lisa is making it.
100%. A lot of them are actually pretty miserable. They're going from job to job. And when I say make it, I don't mean like they are starring on Broadway. They're in the chorus. They're doing these things. There's little side gigs. Some of them have like originals, but none of them are, at the Tonys, right? So, it's a lifestyle choice. And that's what it comes down to. I wanted to be secure. I wanted to have a family. I wanted to make an income enough to take care of my children and my family. And I knew that probably being, on Broadway, if I ever did get the chance, that it pays pennies, let's be honest, So I had to be realistic, unfortunately.
So not to keep going down this rabbit hole, but I'm going to just for a minute, Joe. So when someone is in New York City and they're on Broadway, and whenever we go, we get to go to a show or two, and then whenever they travel, they come to both Tucson and Phoenix, and we oftentimes go to the same shows that we saw in New York. Do you have friends that get on the travel tour too?
Yes, yes. A lot of them come to Chicago. Usually it goes New York, Chicago, Los Angeles, Detroit. That's like kind of the train. And so I'm able to see them in Chicago, and then I go to Michigan and see them. And when I was living in Los Angeles, I was able to see them too. So it was really cool to see that. It was very cool.
That's so fun. And I can definitely, and Joe and I talk all the time about some of the most interesting people in our profession aren't those that majored in biology and chemistry and things. They always have something on the side that makes them unique. And the ability to, like you said, to perform in front of a group is a gift. It's one of the hardest things to do. So that's really neat. I always see these stories about the actresses that take on a new role. Like when Joe, we talked about this a couple weeks ago, when Sutton Foster took on the role at Sweeney Todd. It's like she went and she studied it for a weekend and then went and played it. It was unbelievable.
Absolutely. And then when she was in Shrek, I mean, it was something totally different, I love Sutton Foster. She's amazing. I actually met her a couple of years ago, and her whole role has changed. And I think her current role that she was last in, which was Music Man, that was like a big step out for her. She's normally this like giddy, modern Millie type actress. And then she went the other extreme and became this prim and proper Music Man lady librarian. And it was weird to see.
That's incredible. So, at what point did you say to yourself, you knew you wanted to be in podiatry from a younger age, but in college, was there a tipping point? Or was that you were just going to be a podiatrist from the get-go?
It's tough because at the time, the medical schools accepted the GME, right? The GRE, right? They didn't all accept the MCAT. Do you guys remember that? I mean, this is a long time ago. I'm showing my age, okay?
I remember that. I remember voting for the MCAT to become part of the school process. So, yep, I remember that. I validate you, Lisa.
Right, exactly. So, it was one of those things where it's like, I wasn't a great test taker. And I took the MCAT and I took the GRE. And obviously, everybody does better on the GRE, but I remember thinking to myself, like, is my MCAT score going to get me into medicine? And it would have gotten me into an MD or DO school. But because I knew at the time, how poor of a test taker I was, I knew that I wasn't going to be a surgeon. I had to plan for the long road, right? I had to be a surgeon. I wanted to be a surgeon. And if I went to an MD or DO school, there was a high chance, based on the schools that I got into, that I would have been a primary care physician. And that would have hard stop right there for me. I remember thinking to myself, like, I have this way and I love the foot and ankle. I've had issues. It's relatable to me. I want to do this. And so I chose to go the podiatric route.
What was it about surgery that you were so interested in?
I think the whole idea of not, sitting on my hands the whole day, right? Like it's arts and crafts to me, right? It's that part of the brain putting things back together like a puzzle. It's being creative. It's allowing yourself to explore new things to use. And you use a different part of your brain in clinic versus in surgery, right? So to be in the operating room the majority of the time, that was exciting to me. That was really exciting to me. So that was the big thing.
It's interesting because it's one of our selling points for the college, right? I mean, if you go into the DO schools now, they're opening up every year in one state or another. And there's like 75% chance that if you go DO route, you're going to be in primary care. And so I think that's a big selling point, knowing what you're going to be when you grow up the second you enroll in a podiatry school. Grow up, figuratively.
Yeah, absolutely. My husband's an emergency medicine doctor, and he always told me, he's like, if I don't go into ER, I'm not doing medicine. Like, I'm done. And I said, there's a chance that you could be a primary care physician. He's like, I would take years off. I would do research, come back and go back into ER. And I said, I don't want that guarantee. I want a guarantee that I'm going to be in the operating room and using that part of my brain, because I knew that that's what I was potentially good at, So I think that's a huge selling point for podiatry school. And I know that there's like such a shortage out there. And I hope that people listening right now understand that this is I don't want to call it a selling point, right? I'm not in the OR all day, but it gives me the opportunity to take things from the time when a patient walks in to the decision that surgery needs to be done, to showing them that there's an outcome and making them walk out pain-free. So I didn't want to just stop and have to refer out. I am the referral for everything.
And I like what you said, Lisa, because I'm also not a huge fan of this idea of trying to sell people on come be a podiatrist. But I think there are so many people that just don't know that it is an option that's out there. And so just the lack of awareness. And then I think there's another subset of people that perhaps kind of always have this curiosity or interest in medicine, but maybe they don't feel like they're good enough or smart enough. And this is where I'll switch to the I language part. Being an art major, no way did I think that I was smart enough to be a doctor. And I took the MCAT, and I also did not perform the way that I had hoped to, because I don't do well on standardized tests either. My GPA was stellar, but standardized testing was just, I would get serious test anxiety, and it just really impacted my scores. But that wasn't the reason that I didn't go into med school. When I found out that there were these opportunities to specialize early and have the opportunity to also do things like surgery, exactly to your point, meant that I could take care of a patient from start to finish. It doesn't mean they had to go through surgery, but I wanted that kind of holistic, full care of a patient, that I could actually provide that kind of service without then having to hand them off again to someone else. So I agree. This is not like a selling thing. This is an exposure. Like, hey, this is an option, and it's an option for a lot of people if they are interested.
Yes.
And so
it's so interesting that you said that, Joe, because I want to interject real quick, because my husband, who I did meet in medical school, who is an emergency medicine doctor, I find him at night scrolling through his patients that he has seen in weeks past and go, well, what happened to them? Yeah. What happened to them? He doesn't get that closure of did they die, or did they get to surgery? Did the AAA get fixed? He doesn't know. He just moves on to the next day. And so he feels sometimes like that part of emergency medicine is lacking, because he doesn't have that type of closure where he follows these patients from beginning to end. So there are some pros and cons. Like, sure, it's great to be an ER doc, but like you don't get to see everything,
That's actually really interesting, because when you think too about like the FACFAS survey just came out, APMA survey came out, and the job satisfaction in podiatry is actually, again, we actually have evidence now. It's not all of us just saying, yes, we really love being a podiatrist. We actually have a survey that helps validate this concept, that it was like 85%. It was a very high number of highly satisfied in their work. And I actually think that might be exactly it, Lisa. You get that closure. Yep. You get the kind of instant gratification of helping people, but then you also get the closure of things that that combination of both of those, I'm sure has a direct correlation with job satisfaction.
Absolutely.
What do you think, Jeff?
Oh, there's no question. I have friends that are anesthesiologists and friends like ER docs, but it's a personality type. Some of them don't want to have the follow-up in the long-term relationship. So I think that for those of us that enjoy seeing a patient come in and helping them and seeing them through to the end, where when you discharge them from the clinic, they're walking in, life is great, is a special thing too.
Absolutely.
So I'd love to transition this a little bit. I am not a believer of this idea of follow your passions. So I'd love to scratch this just a little bit with you, because you had that moment in your own life of being able to sit down and think kind of rationally, like, what do I want my life to look like? And I'm also a huge advocate for, you can build the life that you want. It's not going to be easy. It is going to be strife with obstacles and things that you don't predict. And there's fear that you have to learn how to overcome. I'm curious what your take is on, you've had a couple of different experiences in your life. You'd go from Michigan to Illinois to the West Coast, back. How does any of that kind of resonate with you?
You can't plan for anything.
Yeah.
It's am I allowed to swear on this thing? I mean, it's
we can edit it.
Yeah.
Miles, we might need a bleep.
No, it's fine. It's a blank show, like I'll give you a great example. When my daughter was born, I did not practice medicine for a year and a half. Not that I didn't want to. I moved back to Illinois, closer to my parents who were in Michigan. I was ready to get a new job, and my daughter was born, and they found that she had hip dysplasia. She had 2 surgeries at 6 months old. She was put into a full body spica cast, and no daycare would take her. So I was home with her, not doing surgery, not practicing medicine for a year and a half. I had to hold her physically upright in one of those like ergo type straps. You remember those, Joe, I'm sure.
Oh, yeah.
And I would carry her around. And then when she would sleep upright on pillows because she couldn't really be flat. It was very uncomfortable. I don't think I slept for a year. I think I still have PTSD from it. And it delayed me getting board certified. It delayed me from, obviously progressing in my career, getting a good job, probably opening this office. I mean, there were so many things that it postponed in my life, but you learn to become resilient from it. And you learn that you'll get there one day. It may not just be now. And it's not a denial in your future. It's just a mild delay. And you can use that mentality probably in anything. And taking a test your first year of medical school, you can use that in, not getting the residency program that you thought you'd want. That happens all the time where people are promised residency programs and then they come out and they got something at the bottom of the barrel to them, right? But they thrive and they still become a podiatrist and they still do amazing things in this life. And it's not a denial. It's just a delay in whatever gratification or success that you have. So it just,
Oh, I love that. Yeah. And I like how you phrase that because, certainly, and we're going to get through your laundry list of accomplishments. So while you feel delayed, I will just validate that you are very much on track to still continue to be a superstar. But I think it's interesting because I've definitely seen this trend among high achievers and even in our students that are very much high achievers, this expectation that we carry for ourselves. We have our own set points and goals and things that we're like, okay, by the time X is like I expect to be, and life doesn't always fit your 10-point plan, right? And I remember I have a best friend who's just an absolutely amazing human being, not medical at all. But I remember talking with her about like plans and how something was going to change pretty dramatically. And she had said something, she's like, well, part of the plan is to divert from the plan, right? And I was like, you know what, that is brilliant. Yes. Because we don't always build in that it's great to have a template, but that template is in no way, like nobody cares whether you did it the first year or the second year. These kind of arbitrary lines that we bind ourselves in, I find really fascinating. I'm curious, actually, Jeff, I don't think this is a uniquely female perspective, but I do think that we do things differently as females. And I'm curious what your take is on this idea of like timelines and goals. If you feel the same kind of pressure, if you felt that same kind of pressure when you were younger, or even now, maybe.
Yeah, well, those are great questions, Joe. This is funny because we have these discussions all the time because my kids are of the age where they're getting married and starting to have kids and things. So I made a comment the other day was I didn't really feel pressure in life until we were going to have our first baby, right? Because I was going through life, college, podiatry school, life is great, fun. All of a sudden there's 3 of you or there's going to be 3 of you and you got to bear down and get serious. And I'm going to answer your question kind of on in a sideway approach, Joe, because when I saw Lisa's CV, and I said, oh my gosh, Lisa's Lisa's all over this podiatry career. I mean, there's nothing here that if you said, I'm going to do this, is going to stop you, right? And so maybe this is a tangent to that, Joe, but I pulled up this quote that I've liked in the past. It's, if it's important, if it's important, act with urgency. If not, don't do it at all. And so as we go through life, we have these really important things, and then we try our hardest to do them and do them right and do them in a timely fashion. But that doesn't mean it's going to happen today, to your point. It could happen next year. It could happen 2 years from now. And Lisa, you're a classic example of that. I mean, when I look at your CV, I would have never thought you took a year and a half off or to care for a child. I mean, your CV is impeccable. So I don't know about that, Joe. I'm not sure, because you kind of take things as they go, and you don't want to be a squirrel either and just go from one thing to another. But we do that sometimes too, I guess.
Yeah. What are your thoughts, Lisa?
I think that especially for a woman, like we feel things need to be linear because we put so much pressure on ourselves to take care of other people before we take care of ourselves, whether it's our kids, our husband, our job. And I'm not saying men don't do that, but there is that communal pressure to make sure the family is okay. I'll never forget it when my mom, I'm not kidding you, she called me about an hour ago and she goes, well, what are you doing? I'm like, I'm at work seeing patients. Well, then who's taking care of the kids? All right, 1950s mom. Well, my husband's home, right? And the babysitter's there and she's making dinner. It's all good. And I got a podcast tonight and we're good. We have other things to do in this life, and it's okay to take care of yourself before other people. And I think it takes a lot of time, and I hope students are listening to this, because the pressure that you put on yourself to be linear is normal, and it's full of anxiety, and it's anxiety provoking, and it's what makes you great. It's what makes you really, really great to do things from the next level, from undergrad to medical school, to taking boards, to passing boards, to getting a good residency program, to passing boards in residency, to getting a fellowship, to getting a good job, to branching out and doing your own thing. I mean, it's like, it's all linear, right? It's like, this is what we're taught to do. So like, why not have that added pressure? Because that's what the norm is. But you get to this point in your life, I'm 42 years old. You get to this point in your life and you say to yourself, I don't have to be linear anymore. I can say no. What does that feel like? That creates more anxiety in me than having that pressure, right? So doing all these things that you see on my CV, it looks good, right? But like, I wanted to do it because that's what I was taught to do, right? Let's be honest here. But now that I'm at this age and it's like, I've done these things and it's been wonderful, I can now say, okay, I'm not going to do that. I'm going to focus on this. I'm going to take a step back from this and do this instead. I have the choice now. And that's why we work so hard. That's why we put so much pressure on ourselves so we can do those things when we are older. Right?
Oh, I love that so much. I'm gonna scratch that itch a little bit more, but first, maybe we take a quick break to hear from our sponsors, and we'll be back on that point.
We all know that early detection is the most important determination in improving patient outcomes. Bako Diagnostics remains committed to supporting you in your role as the first line of defense in diagnosing lower extremity pathologies. Bako Diagnostics, helping podiatric physicians keep America on its feet.
All right. So I love the idea about this like linear path. And certainly my favorite part of doing some of these interviews with people is as a spectator of someone else's success. It looks so linear, right? Like they did that and then they did this and then they did that. And it just looks like everything was intentional. Everything was planned out and man, everybody's got it figured out but me, right? And the reality actually comes down more and more as you hear from people how intricate and winding and kind of random sometimes. And, oh, I followed a girl out to this other program. Like, that's why I went to this place. And things are organic. They're not linear. They're not as structured as they might appear.
Right.
And certainly where I'm going with some of this stuff is we had a conversation in the interview with the Boards Blast that talked a little bit about stress and grit and resilience that I want to get back to because it's a hot topic to me. But first, I want to talk some of these stuff on your CV. So in terms of teaching, Lisa, you are faculty currently for the Rush Residency program. You're the chair of several different academic courses, including ACFAS, the Complications Symposium, the Women's Symposium. You're faculty for the American College of Foot and Ankle Surgeons, for AO, for the Podiatry Institute. You've done lectures at some of the different colleges of podiatric medicine. So you are incredibly engaged in teaching, from students to residents to faculty members, other podiatrists. This idea of stress, can you come back to this? We had talked about motivating students and expectation setting. What is it about stress that you think is valuable?
I think, and this isn't everyone, and I talked about this with the Boards Blast, seeing stress as a challenge as opposed to a negative deficit. When people see stress as a challenge, they rewire their brain into thinking that stress is a positive thing. When people look at stress as debilitating, that's when we get in trouble. And that's when our brains turn off. Whether it's studying for an exam, you get overwhelmed. It's too much, as opposed to seeing it as, this is what's been taught to me. I'm going to prioritize X, Y, and Z. I'm going to tackle X, Y, and Z and feel really good about X, Y, and Z today. And then I'll do those next week. I don't need to focus on that and overstress myself. And then you accomplish those three things and you put the check box, the check in the check box. You feel really good about it because you saw it as a challenge, you accomplished it, and you moved on. And if you see stress as a challenge, and that's just like a minuscule way of seeing it, you become more successful, you become more resilient. So that's the way I look at stress.
Yeah, I love that. Jeff, your thoughts?
I started thinking, I think it was Billie Jean King who said pressure is a privilege and stress is kind of the same kind of thing, right? You put yourself in a position where you can perform and deliver at a high level. You worked hard to get there, so there is going to be some pressure. But if you look at it as a challenge, like you say, Lisa, it puts it in a different perspective. So there's so much common threads here with performing arts, with surgery, with giving lectures, with life in general. I think that the thread's common, and I think pressure. I like that term, pressure is a privilege, because we get stressed out sometimes. You think, wow, I'm lucky to be here in a position to have this pressure on me. So it's another way of looking at it.
And I will say this, I was in a really bad spot. Like, people think, oh, she comes from a great place and she's done all these wonderful things and she's teaching and she's like on stage and I'm great, yay, and everything's great. But I mean, I, along with a lot of people listening, have had horrible hardships in my life, right? We're not going to get into those, but one of them, just last year, 12/1/2024, I was at a horrible job. Okay. Like, when I talk about the worst type of job you could possibly think of, financially, verbally, I mean, you name it, it was a bad position. I was there for a very long time. And there were some things that were hidden from me. There were some things that I wouldn't get paid on. I mean, if you had to write down all the pica things that you're not supposed to do, that's what I was in. Okay. And, it was a disaster. And I remember thinking to myself, I have to get out. And this was hard. This was difficult. This was one of the most difficult things that I've done in my life, because here I have the stable job, a stable income. I'm, taking care of my kids. It's more comfortable to stay. And sometimes we look at handcuffs as being a blanket, and that is not the way that we need to look at them. We need to look at them for what they are. And it would have caused me far less stress to stay, far less stress. But I put my big girl panties on and said, I got to get out of this thing. And I opened my own practice, and it was the biggest risk I ever took. And I was, up for nights and figuring out how the heck am I going to pay for this? And what does this mean? Am I going to eat ramen the rest of my life? I have this huge loan now. I mean, the stress of it all, it was just nuts, not just for me, but for my entire family, for my extended family. I can't even tell you how difficult it was. And again, you have to see stress as a challenge, because on the other side, it is so much better. It is so much better. And I've never been happier. I've never been more stressed out, but it is a good stress and it is wonderful. And just because it's not working out for, someone who's listening to about a residency program or about an exam that they took, it doesn't mean that they're going to stay there in that moment the rest of their life. I promise you will get out of it and you will be better for it.
Oh man. And that I think is one of the things, that this idea that there are cyclical moments in life, and leaning into the times that are good and feeling so completely unabashedly embracing the good. And I'm not going to feel any kind of guilt or weirdness about it. I'm going to love every second, because it's not going to last. And that's not to be fatalistic, but it's just to say, celebrate the good. And then in those moments where it feels like it couldn't possibly get any heavier, it's not always going to be that way. That is great advice. Great advice. Yeah. I wish I had known that in some of those really hard moments. It's not always going to be that hard. No, it will get easier. It just takes the slugging through the mud to get, you just have to crawl out of it. And that's the hard part.
Oh, absolutely. And these residents, if you're in residency right now, I remember thinking to myself, I'm never getting out of this. This is hell. This is what hell looks like. I don't understand how I can be working 36 hours, eat sleeping at the hospital, hooked up to a banana bag. I'm sick. I can't go home. I mean, residency was insane. It's not like that anymore, but back in our day, it was rough, but the more that my husband always says, you got to put one foot in front of the other. You just got to put one foot in front of the other, and you keep going, and you can all of a sudden you see the trees and you're like, oh, I made it.
Yeah. I remember distinctly at one point, and when you talked about residency, it was the middle of second year, and second year's hard, right? Because first year, everything is new and it's changing all the time. So you can do anything for a month. Literally, I could survive through anything for a solid month, because I knew it had an endpoint. Second year, though, for our program, you're in it, you're right in the middle, you're still far enough, you can't quite see the end, but you're too far in to quit now. It's just and I just remember being at that moment, just like you said, it was 4:00 in the morning, and I was waiting for some post-production films on a wrist of something, right? I'm sitting there, and my best friend sends me these pictures, and she's traveling around the world, and she was hugging a tiger, not like a little baby tiger cub. And in that moment of you're like, what am I doing? Why am I doing this with my life? Right. And it was exactly that moment. Joe, you knew this was going to be hard. You signed up for this. You specifically signed up for this program because you knew that it was going to be hard, and that it was going to push you, and it was going to challenge you. So you're not allowed to whine and complain. You can have your little moment, but then you need to get up and you need to go back to work. Oh, yeah. And I think this idea, that's why I really liked the way that you had phrased that when we talked about it with Boards Blast. And this isn't to say that mental health is not important. And we're going to switch to that in a second, because the first time, you don't know this, but the first time that you ever kind of really landed in my radar, you were talking at one of the FACFAS wellness sessions. And I very much resonated with some of the comments that you had made in that session. But this idea that stressful things are going to happen. There are normal amounts of stress that are expected. Same with normal amounts of anxiety. These words have gotten tagged as bad words, but anxiety is a normal and helpful feeling. And so we need to be careful about, throwing it out too easy peasy. It becomes a problem when it really starts to get in the way of you being able to keep stepping forward. And stress is the same way. And so I'm curious, and you don't have to get too personal if you don't want to, but in some of these moments of uncertainty and high stress, what are some of the things that you help? How do you get out of it to just keep moving forward?
Yeah. I mean, I think I said it in Board's Life. If you don't have a therapist by the time you turn 40, there's something wrong with you. Like, straight up, there's something wrong with you. You have been through every aspect of the highest level of stress, from a pre-med degree to taking the MCAT to getting into medical school to being literally like a fire hydrant of information coming at you at one time, right? I mean, med school's hard, okay? Half the information I don't even remember. And then you get to residency, you take your board exam. I mean, you know the whole linear path. If you haven't suffered from mental health by that point, by any of those points, there's got to be something wrong with you, because it is so normal. I don't think I have one friend in medicine that's a podiatrist that hasn't been to therapy. You have to dump on someone else, whether it's a problem in your relationship, whether it's a problem with an attending yelling at you, whether it's a poor outcome from a patient. It's going to follow you. It just comes in little different packages throughout the way. And mental health it's a serious thing. But it's so normal. It's so normal. And if you don't have that someone, whether it's a group of like-minded individuals that you can bounce ideas off of in a similar group setting, or if it's, your colleagues that you work with, or if it's a therapist, like, you need those people to feel normal, to feel sane. And I mean, I've been in therapy since I've been 21 years old, and there is nothing wrong with that. Okay. And it is something that I love my therapist. Now we just, we talk about everything under the sun. We'll probably talk about this podcast, right? And how neurotic I am, but it's normal. It's normal if you are at that point where you can't get through the mud. Get on medication. I'm not advocating for it. It's not something, I'm not telling people to do that. It is normal. It is normal. It is normal to, call your parents in the middle of the night sobbing, saying, I can't get through this day because of X, Y, and Z. These things are normal. And the more that we kind of hush them, and it's not politically correct to talk about X, Y, and Z, the more that it, in my opinion, it makes those depressive states, anxiety, much worse. So, huge advocate.
Yeah, we definitely go ahead, Jeff.
Oh, I agree with you. So I made a couple notes, and I was thinking while you were talking, Lisa, that we're trained to be resilient, right? But even more so, we're trained to compartmentalize. Because if you think about our life, you wake up in the morning, you're eating breakfast, you've got the kids, life is great. You go to the office, you're doing rounds, patients aren't doing well, you're seeing patients in the clinic. One patient's doing great, the next patient has a new problem, and you're just juggling. We become masters of putting like 20 plates in the air. And so that is a skill set. I think that's very common in high level performers, but I think that in medicine, because of the nature of medicine, it's like, Joe, how education's kind of cyclical, and we deal with things every year, every 6 months, we got to do this and that. But when you're a doctor, it's like it's coming at you every day from every direction when you're seeing patients. So compartmentalization, it seems to be a skill set also, Lisa. And it's fascinating to me watching our students, and so many of them they're studying. They've also got families. They've got other issues going on. I mean, we all have gone through a lot of that also, but I'm always impressed with the human trait of resiliency and accomplishment. And what you said is absolutely correct. I mean, if you need help, by all means, there's nothing wrong with that.
There's nothing wrong with it. And then the other part of that is learning to set boundaries. That's a huge skill set. That is something that I'm still learning. And it's funny, we do this with our kids all the time. They yell and scream, they have a temper tantrum. Okay, well, if you do this, you get your tablet taken away. We give out the boundaries all of the time. But when we don't do that for ourselves, that's when our stress level continues to rise. So when we don't set that boundary with that obnoxious patient who calls you in the middle of the night for, heel pain, or the demanding patient, or the patient that won't pay their bill, or the fellowship director that's constantly verbally abusing you. I mean, there's so many times where it's like we just accept things because we think they're normal, or we're too scared to say no out of fear of retribution. And these are things that we have to learn to prioritize I don't want to say not say no, but we need to learn to set boundaries around them so we don't get burned out. And that was a big part of my wellness talk last year, because I think I said it in my talk last year. It's like having a life, no matter what it revolves around, and not setting boundaries is like having a house with no doors. Eventually, you're going to get robbed.
I like that.
And this is a nice segue, actually, because the last area that, I mean, I could talk to you for like 4 more hours, but where we will start to kind of wrap up is on some of your leadership stuff. And as we transition from this idea of grit, resilience, and learning to manage stress as the obstacle is the way, as Ryan Holiday says, right? This is a challenge that's been presented before me. This is a puzzle. This is a complex problem that I am capable of solving. That is how I'm going to look at it. I'm going to solve this puzzle. I'm going to high-five myself, and I'm going to move on to the next one. But there are some systemic problems that I think are fair to acknowledge in the world of healthcare that none of us are going to solve today. But as we transition into leadership, you have a long list of leadership roles that you've had in terms of different services that you've provided professionally to the profession in general. Currently, you're the new vice chair of the American College of Foot and Ankle Surgeons Education Scientific Affairs Committee. Congratulations on that. But you serve on the PICA Medical Advisory Committee. You've sat on several task forces for ABFAS, peer review for JFAS. You're a poster judge, which I actually thought was super fun, for ACFAS. I'd love to get your take on leadership style and what you think, if you could design a perfect leadership structure, what would it look like? What do you think is missing?
Oh, I know exactly what's missing. I just had this conversation with one of my chief residents. Oh yeah. Ooh, you just like triggered something in me. I have to be very careful how I phrase this. People in leadership are there for a reason. They have something to say, and it's valuable. There are so many more people that are not in leadership that have better things to say, more important things to say, that are not heard and not given the opportunity to be heard. And so one of the things that I attempt to do, along with a lot of my colleagues that they attempt to do, and I think this is the biggest trait of a successful leader, is that leader is there for a reason. They are smart, they have something valuable, and they are climbing this ladder, right? This is this vertical linear path that they are going to take upwards. But the most important trait that they have to make themselves that much better is to widen that ladder for everybody else to rise with them. Because you are only as good as that slowest, not so great person below you, right? So if you're not rising everyone up on that ladder, then this whole leadership thing doesn't matter. And I think that's where leadership needs to go, because right now it is a one-way path for a certain select amount of people. And all of these people who have wonderful things to say, wonderful things, valuable, such valuable things to give, they're just left in the dust, and it becomes problematic. It becomes, they get burned out. Why try? Why do that when I'm not given the opportunity? So I think the people at the top need to learn to widen the ladder for all of those other people too.
I like that. That's going to be your new hashtag, widen the ladder.
Widen the ladder.
What do you think, Jeff?
I love widen the ladder. Part of being able to widen the ladder is to, and I experienced this when I was clerkship director and starting a residency and even in the schools, is you got to bring in great people, and then you got to You can't micromanage people. You have to let them spread their wings. You got to let them rise and be stars in their own account, with some guidance, of course. But there's a catch there, Lisa, that I've found in the past. If B leaders will hire B and C people under them, A-level leaders will hire great people to be next to them. And I think if we can do that, then you do elevate everybody.
Absolutely. It's funny. Somebody asked me, they're like, "Oh, who'd you hire as your practice manager?" I said, "Her name's Sherry. She's amazing. She knows more than I do. She does this, she does this, she does this. I don't know what I'm doing, but she's doing it." The whole idea is to hire people better than you, so you can become better, right? There's so many great people that are, on my education scientific affairs committee. They're amazing. They're just starting out. And I'm like, you're going to chair that because I want to hear from you. You're going to chair this pre-conference workshop because I want to hear from you. Like these are people that need to be out in the limelight, not just the same old boys club that's been up there forever. But there's so many people, there's so many great people that aren't in leadership positions. And even the students that are listening, you will be in a position of leadership soon enough. I promise you that. And keep doing what you're doing because, you need to be heard. You have great things to say too.
Absolutely. And you just need an opportunity. Joe, we've discussed this before. Like, people, they don't think they've got anything to give back, but they've got lots. They've got years of patient experiences. And sometimes we got to pull them in, right? Pull them in and, give them a lecture or do something to get them excited. And then you keep giving them more and more great opportunities until they learn how to say no. I'm just kidding, Lisa. But you know what I mean? I mean, it's like,
that's actually exactly right, Jeff. Like, creating the opportunities so that then people have the option to say no.
Yes.
Because that hasn't been as inclusive in the past. And I'm very optimistic and excited to see that it has been shifting. And I think that that's exactly it. And Lisa, you just said it, creating those opportunities. Like, I want you and I want you. And I want you because you're valuable and you have something that's worthwhile to be said. And only you can say it. Yeah. And I think that those are having a leadership team that's willing to invest in other people is immensely valuable. And I love that because we have never talked about that, but I was not surprised that I love the widen the ladder though. I'm totally going to hashtag that as your new, like that. that's your catchphrase. Widen the ladder.
When you put people there that are, better than you, right? It makes you look really good. Right?
Yeah. We all do better when we support each other. 100%. Yeah.
So yes, hashtag widen the ladder.
Yeah.
Love it.
What do you think, Jeff? Should we do a couple rapid fire?
Absolutely. Like, I agree with you, Joe. We could talk for hours. We've already been going on for almost an hour. So Lisa, you need to put some boundaries on us. I need to be done in 10 minutes.
I got to go home and eat.
We will keep talking. I have been known to do that. I have been told I might be a little much sometimes.
I love it.
All right. I'll go first, Joe.
Yeah.
All right, Lisa. You've had a busy week. You're tired. You don't want to go home. You don't want to do order something in. You got a babysitter there. You and your husband are going out for dinner. Where are you going in Chicago?
Yes, Joe's Stone Crab downtown.
Oh yeah.
Joe's. Oh God, I love Joe's. I love their crab. I love Dungeness crab. I love stone crab. I love all things crab dipped in butter. It is my jam. I'm going on Friday.
I like the mustardy sauce too.
Oh no, I'm not into mustard.
Oh, you're not.
No, he dumps it all over. Yeah.
Joe's Stone Crab. Every time I go to Vegas, we get that too. It's in Vegas also.
I love it. Vegas 2026.
There you go.
There. Maybe we should have a little event and we can hashtag widen the ladder. Invite some people. Yeah. We'll turn it into an event. I see something happening in the future. Okay. Let's go with strangest thing you've ever eaten. And strange can mean a lot of things to a lot of people. So what's the strangest thing you've ever eaten?
Oh God, I'm so boring. What's the strangest thing I've ever eaten? I don't
Mustard
know.
sauce. No.
Probably a raw Japanese scallop.
Yeah. Oh yeah. Raw scallops. That's
raw scallop. But
that fits the strange food category. Sure.
It's weird, but it's big. It's huge.
Yeah. and they're
I
kind
love
of
it.
slimy.
Slimy, but I like them.
Oh, you liked it. All right.
Yeah. Oh, yeah, it was good.
Fantastic. All right, Jeff, back to you.
Okay, two-part question, Lisa. You have the opportunity to star in a Broadway musical. Which one would it be?
Oh, my goodness. Okay. Anxiety is coming. Hold on. I'm gonna take a metoprolol. Hold on. Okay. It's between Elphaba from Wicked, just because, I love, and probably, it's such a close call. Probably Maggie from Chorus Line.
Very good.
I love Chorus Line.
I love that. So the second part of the question is, what was your favorite Broadway show? I mean, are they the same or would they be different?
Yeah, I mean, it's between Wicked and Chorus Line. They're so different. It's like apples and oranges. Chorus Line, it just gets me every time.
I went to Wicked in London. We were there once. It was phenomenal.
Oh, it's so good. Who did you see? You remember who you saw? Who was Elphaba?
Oh, gosh, I don't remember. I'm sorry. It was 10, 12 years ago. But we went to 2 shows in London on that trip, and one was Book of Mormon, and the other one was Wicked. You couldn't get much different, you know.
Yeah, no. Apples. I love it.
We may have decorated a Christmas tree this weekend in a Wicked theme. I'll send you pictures.
Very good.
My kids are all, well, it's not just my kids. I love to blame my kids for things that I'm super into, but we're all into Wicked in our household. So, big fan. All right. Books. Has there been any major influential books in your life?
I used to read all of the time, and now I'm a horrible reader, but my dad just came out with his book, The Insightful Leader, and that has helped me tremendously in my own career. So if you've seen that, that's on Amazon, but it is a great book. Sorry for that plug, but I haven't read in a while, and I read his book and I was like, oh yeah, it's everything you taught me in my life. So
I love that. Insightful Leader. All right, we'll have to look for that.
All right. Yep.
Christmas list.
Yeah, I like that. Joe, I funny sidebar story. So I came across the story this weekend. So I downloaded the audiobook about the stranger in the woods who went into the woods in Maine and didn't only talk to one human being in like 26 years. And I'm reading the story right now. The funny part about it was that it's an audiobook, right? And the gentleman that's reading it also narrated the Ulysses Grant biography by Chernow. So as I'm listening to this, I'm like, wait, which book am I in right here? Because it was the same reader. But anyway, I just side note. I'm finding all these strange books, and then I get into them, and the next thing you know, an hour goes by. So,
that's really funny.
All right. So it's my turn.
Yep.
Oh boy. So if do you have the ultimate position for you? As you see it today, I realize it's not linear. In podiatry, what would you like to do at the, in the next 15 to 20 years? Another metropolo. I love it. Ooh. It was supposed to be a lighthearted question.
I don't know. I would love to. Probably open up another couple offices. I mean, that would be great and local. I can at some point see myself being on the board of directors for FACFAS at some point, maybe chairing an AO course and being like Joe, because she's amazing. There's so many, who knows, life throws you curveballs, but I say yes to majority of stuff anyways. So.
Yeah, I was going to say, looking at your CV, I don't see a lot of boundaries there. Like if you were a car, an autonomous car, it doesn't buzz when you hit the lines. You know
what though? Think about all the things I've said no to. There's a lot.
The CV only gets the curated list.
Yeah, exactly. Yep.
That's a great point. That's a good way to look at it.
Yeah. It's better than social media because it's like the accurate curated list.
Yeah, exactly.
Absolutely. Yeah. Oh my gosh, Lisa, this is so fun. Do you have any more rapid fires, Joe?
Oh, I could rapid fire all day long, but I think in interest of being polite with her time, we'll wait. We'll have those over some cocktails at an event somewhere. Maybe in Vegas at Stone Crab.
Yes.
Oh, I like that. So Joe, when we put together, I have a question for you, Lisa. When, you think your dad would want to join you on a Dean's Chat episode?
Yeah, he would love that.
What do you think, Joe? And kind of.
Oh, I may have already asked her about that.
Yeah.
Oh, all right.
Yeah. He was on Channel 4 News the other day. It was like a big deal. So yeah, it's cool.
So
I've already started making a list of things I want to ask him about.
Oh, I love that. I'm
curious.
Okay,
Lisa, you have to give a quick bio on your dad so that people
are
like, what are they talking? I mean, he wrote a book, which is great, but what's his background?
Okay, so he's a clinical psychologist, PhD. It's amazing. Talk about transition. So he used to be total clinical, dealing with anxiety, mental health. That has transformed into, he was a nutritionist. Okay. Then that transformed into him working as clinical workplace violence. So within hospitals and large corporations like GM, Ford, dealing with workplace violence that way. And then that has transitioned to this whole leadership position where he gives these TED Talks and things to basically like get the teams together, whether it's in medicine or is in larger corporations. And he's done so much. Oh, and then when he was much younger, he worked at a program that was with childhood obesity. So he has done literally like the gamut of things. But I think his biggest thing is probably the whole insightful leader and the whole leadership directive. And he's called into a lot of hospitals. He gives lectures to residents and to medical students all the time. And it's a lot of fun for him. And he pretends like he taught me everything, even though he really didn't. So if he's listening. I learned my own stuff too, Dad. I learned my own stuff too. But yeah,
it's called learning it the hard way.
Yeah. But he would love to come on.
Experience. Yeah, absolutely.
Yeah.
Your father's name?
Keith Levik.
Keith?
Yeah, Keith Levik.
All right, fantastic. The Insightful Leader. Check it out. All right. I'm going to check it out for sure. All right, Lisa. Thank you so much for taking time out of your busy schedule to join us on Dean's Chat. It's been a pure pleasure to chat up all kinds of topics.
Thank you so much for having me. It's been such a blast. And I look forward to the next time. I love this stuff. So thank you, Joe. Thank you, Jeff, for everything. I appreciate your time too.
Well, thank you so much. Any last words, Joe?
No, thank you so much for your dedication to the profession and for widening that ladder.
Hashtag widen that ladder.
Yeah. We're just going to mic drop there.
Well, we've got a few mic drops in this episode, a couple that we want to do for the podiatry profession as a whole, too. I mean, your description is incredible, Lisa.
Yeah.
So to all of our listeners, if you're listening on Apple or Spotify, please give us a 5-star rating, or even better yet, leave a comment or two. And if you're watching on YouTube, by all means, become a subscriber. Joe and I will continue to bring leaders in the profession, like Dr. Levick out of Northbrook, Illinois. Thanks again, Lisa, for joining us. And part of our gratitude is we're going to send you a Dean's Chat mug to get your day started or ended, however you want to look at it.
Thank you. I look forward to it. Thanks so much.
All right. Cheers, everybody. See you next week. Bye-bye.
Bye-bye.